Anytime you have ground beef, it's going to be high in fat, very high in fat. For people who we put on a very low-fat diet, we generally choose some figure for total fat such as 40 grams a day. And we ask them to stay underneath 10 or 15 grams of that being saturated. There are various subtypes of cholesterol. The so-called good cholesterol is called HDL, or high-density lipoprotein. The so-called bad cholesterol is low-density lipoprotein. That buildup of cholesterol is in the LDL form, becomes oxidized, becomes highly inflammatory, attracts migratory inflammatory cells to the individual plaques where the collections are, and ultimately results in narrowing of the coronary artery. In people that have high cholesterol and are at risk for cardiovascular events, we generally suggest that they switch to a lower fat diet. And we do that in terms of meat if they like beef. I always suggest that they go to the lower cuts of lower fat cuts of beef, such as filet or trimmed up sirloin. That is roughly 4.5 to 5 ounces. And that's the size of the piece of meat that you should have. You'll notice if you go into a restaurant, about the smallest piece of meat you can get is 6 ounces, and most of them are 8 to 12 ounces. So if that's the case, I suggest to them that they simply order the regular steak, cut it in half, and take it home and utilize it a couple days later, perhaps in a salad.